Around 2 billion people are infected worldwide with Mycobacterium tuberculosis. This equates to about 1/3 of the world's population. Of this group, about 5 to 10% infected people develop the active tuberculosis disease. This is a gram-positive, rod-shaped bacteria that behaves like a virus by invading cells and replicates inside them. Specifically, it infects macrophages. While it primarily infects the lungs, it can infect other organs as well. It is an obligate aerobe and is slow growing, so the lungs are the perfect place for it to infect while it multiplies. After being inhaled, the bacteria make their way to the lungs and infect the macrophages found within. This triggers an immune response that allows for more macrophages to enter the lungs. The infected macrophages are then covered by the uninfected macrophages. This forms a tubercle within the lungs, which is essentially a mass of these macrophages. The bacteria slowly replicate over time, and if any bacteria or infected macrophages escape the tubercle, the surrounding macrophages attempt to stop the spread. This is considered the latent form of the infection, since the host presents no symptoms and the infection is localized to the tubercle. In this form, the host cannot transfer the infection to other people. This is the case for 90 to 95% of the people who have the infection. In the event that a tubercle bursts and the infected macrophages or bacteria are able to make it into the bloodstream and the lungs, the host would enter the active part of the infection. The active infection causes the host to present with a cough, a fever, chest pain, and even coughing up blood in some cases. Without treatment, this active tuberculosis has a mortality rate of more than 50%. Part of the reason for this is that the bacteria have a waxy cell wall that protects it from most antibiotics and keeps it from drying. The treatment for this involves specific antibiotics that must be taken over 6 to 9 months. These are all part of why people with latent TB infections should be treated to prevent the development into active TB disease. Treatment for the latent disease substantially reduces the risk the latent infection can progress to an active infection. Since the mortality rate is incredibly high for active infections, it should be a top priority to ensure that we limit this development. In doing so, we could make it so that the majority of people are treated and the active tuberculosis is stopped before it becomes a problem.